This segment on Bridge Street is sponsored by Aging Advocates CNY.
Well, people are living longer, and that's a blessing for many of us, Tim.
It certainly is. We all hope for a long life for ourselves and for our families, but one with dignity and independence. Aging Advocates of CNY work year-round to make that possible. Melissa Murphy is the founder and CEO. Amberly Reinertson is executive director, and they are both certified dementia practitioners. Ladies, thanks for joining us this morning. Talk a little bit about, there's always a question of dementia and Alzheimer's and how that, what's the difference? Tell me about that.
Sure. So dementia is really the umbrella term. There are, several types of dementia, Alzheimer's being the most commonly known.
So my grandfather actually had Alzheimer's, so I know a little bit about this subject. But Melissa, take us through some of the warning signs, if you will, that family members should be looking for when it comes to dementia and Alzheimer's.
Sure. So the most common is change in their memory, but also we see changes in just daily behaviors, getting lost, the inability to just manage their daily tasks, whether it's something as complex as managing their finances, using the remote, phone, and also change in mood.
We've seen increased anxiety, trouble finding words, so making a complete sentence or, not using the correct word.
How does a family know when to be concerned? I mean, you're not finding a word, but not finding the car keys is, common.
Happens for all of us.
Yeah, it does.
Word finding.
Yeah.
We're always struggling with that. But so the main difference is, you know yourself and you know your loved one. So if you are seeing any of those symptoms that we just mentioned, it's really important to first go to a medical provider, whether it is your primary care physician or emergency medicine if it is a drastic change. So the first thing you want to do is rule out a possible infection. So something as simple as a urinary tract infection can be detrimental to somebody at a later age and cause a severe change in their behavior, mood.
And those can come up quickly.
They can. Most commonly caused by dehydration, which of course can change your mood as well.
Yeah.
Melissa, you touched on it right there, but let's say, there's a family member that you're concerned about, but that family member says, no, I'm fine, I'm fine. What would be your advice to get that person to get the proper testing and medical needs that they would require?
Good question. So every case is very different. So again, knowing your loved one and how to approach them, getting them to their primary care provider first to rule out an infection, as we mentioned. Also, medications can sometimes interact with each other and they have side effects. So there's many things that could be causing dementia-like symptoms that you want to first rule out. So maybe coming with that approach that I don't necessarily think you have dementia or Alzheimer's, but I am concerned. Let's get the appropriate treatment so we can then move forward.
That's a good tip.
The walk to end Alzheimer's is coming up not too long from now. Talk a little bit about that.
We're so excited. The walk is something that's very near and dear to my heart because I lost my grandmother to Alzheimer's a few years ago. But yeah, the walk is September 25th. It's at the SRC Arena, 11 a.m. And we would love if, everyone can join us. Again, it is something that's so near and dear to my heart. I can't talk too much because I'll get emotional, but it really is such a great cause.
Melissa, are we seeing progress in strides being taken in the ways that Alzheimer's and dementia are treated?
Yeah, so the Alzheimer's Association is one of the biggest funders of research and development for the disease, but where we come from is the standpoint of, again, it's not always Alzheimer's disease. There are several other types of dementia. There's actually hundreds. And there's also other things such as Lyme disease that can mimic dementia. Even anxiety and depression can have symptoms that mimic dementia. So again, yes, we would love to have a cure for Alzheimer's. That would be wonderful. I think we are making strides. There are some medications, and everyone is so unique, so sometimes it is a matter of finding the right diagnosis, which can be very challenging. That's where we come into play. Sometimes it takes multiple doctors, professionals to even try to get an appropriate diagnosis, but then what can we do once we have that information?
And really, socialization and stimulation really helps stave off the progression of the disease. So, if you notice that your loved one has, symptoms or has been diagnosed with dementia or Alzheimer's, really just making sure that they are, being able to get out, you know, social, stimulated games, not just sitting in front of the TV watching TV.
Ladies, we appreciate that. To learn more about the signs of common conditions resulting from aging, visit agingadvocatescny.com. You can also learn more about Aging Advocates CNY by calling 315-480-4770.
Thank you.